Hello, and welcome to the Avama webinar on how to automate COVID-19 vaccine scheduling with conversational virtual assistant bots. I'm Kunal Contractor, the Global Director and Head of Healthcare at Avama, and I will be your host for today. So, firstly, before we get into it, I'm sure you've seen and experienced the evolution of how people have been interacting over time, from needing a good website to a mobile app, and now we're really moving into a conversational first strategy thanks to AI. With that in mind, it's not just us saying that. Frost and Sullivan say that 90% of hospitals will use AI chatbots to save lives and improve the quality of care by 2025. Um, we're also seeing a 50% reduction in the cost of treatment and 30 to 40% improvement in outcomes can be achieved through AI-driven bots in hospitals. And finally, Accenture are also seeing $150 billion in annual savings that can be achieved in the US healthcare economy by 2026 with the implementation of tools like chatbots. So quickly, a little bit about Avamo. We're backed by Intel as a lead investor, which is a solid seal of approval. And our team come from the range of companies that you see here on the bottom line. Here is a selection of some of our customers in the healthcare space, at least the ones we can name anyway, from the NHS across the pond in the UK, where I'm from, to some of the best healthcare systems and payers here in the US. In addition to that, we have a number of the top 50 health US systems, whose logos I can't just show just yet, a number of the top 10 payers and insurance, as well as actually a number of state governments, the Department of Health, both actually all around COVID testing and vaccine scheduling, so highly relevant for what we're going to go through today. And again, it's not just our word or our customers' words for it. We get some pretty great recognition and press and from analysts as well, such as Gartner. And Forrester have also named us as the absolute leader in conversational AI. So to set the scene for how to really automate vaccine scheduling or ultimately any kind of appointment scheduling in the healthcare environment, it's best to first understand all the different ways that we can actually automate a conversation. And we do it in three main ways. First is talking to your content or a knowledge base. So we've done this, and I'm going to show this to you in a second, having integrated with and understood and read and ingested all the content from the CDC, NIH, World Health Organization, and Johns Hopkins to do with COVID to create a bot where you can literally talk to these knowledge bases and get all the information you need. The second kind of conversation is talking to an enterprise application like Epic or Cerner or ServiceNow, for example, to really being able to have a transactional interaction, such as scheduling your appointment through open scheduling in MyChart, for example, in Epic, whether it's for vaccines or just going in to see your PCP. And that is done through text. And the third kind of conversation we automate is talking to your contact center through conversational IVR, which is really what I'm going to be focusing on today and the demo that I'm going to show you in just a few moments' time. So, of course, when it comes to any kind of healthcare scheduling or any really healthcare type topics, you're going to make sure whatever vendor you look at has the highest level of security available today. So we have our HIPAA compliance, GDPR across in the UK, ISO 27001, your SOC 2, Type 3s, etc., hosted here in the US. We can provide voice biometric authentication, plus others. HIPAA, PCI, PHI, PII security is not a problem. And not only are we hosted on an AWS HIPAA compliant environment, we could actually install our entire platform on your cloud, no matter who your provider is, whether it's AWS, Google, Azure, etc. And we can install the platform traditionally on-prem for you too. So now, focusing a lot more on our conversational COVID care capabilities. So I'll be going through our Project COVID, what we're doing for vaccines and scheduling, as well as for COVID tests as well. And I'll be doing a live demo in just a moment. So first of all, we have our Project COVID bot. It's actually available for free. It's what I just mentioned a few moments ago, trained with all the pages related to do with COVID, again, from the CDC, NIH, World Health Organization, and Johns Hopkins. And again, did I mention it was free? So feel free to come and check it out and let us know if you'd like to use it. Here's an example with Emblem Health. So it's live on their site right now. Another example is with our client at St. Luke's. So it's again, customized to your branding, to their environment, information on vaccines, for example, and testing locations. And when you ask a question, it shows you exactly what the answer is with a sourced link to open up the page. So again, it takes you to exactly the source of that information, and it's not just something found on some random pages on the internet. So now when we come to COVID test scheduling, what we're able to do is automate the registration of people who may not already be a patient within your system, scheduling their appointment, confirming it, rescheduling it, and even canceling that COVID test. You can also, on the same line, get your test results or view them in text, and also get better information in terms of what to do if you've actually been tested positive for COVID. If you have been tested positive, I'm sure you're going to have a lot of questions. What should I do? Where should I go? You might be living alone. I want to know, how am I going to, excuse me, survive with this living all by myself? Or maybe you're in a larger household. How am I going to live at home and, protect my family to make sure they don't get infected? What should I do if my symptoms change or evolve over time? So our COVID Care bot is actually available for you 24/7, in voice or in text. So you can reach out to it at any time and ask it any questions that, again, have been pre-validated and are clinically accurate responses, which is an aggregate of all the information that we have, again, from the CDC, NIH, World Health Organization, and the health systems that we work with today. This is actually also being implemented by a number of state governments as well. So for example, here's a particular workflow. So when it comes to scheduling a test, if you have already been pre-registered, whatever EHR it's in, we'll check if you're a first responder, are you calling for yourself, with the correct relevant modifiers. If you've not been registered and this is the first time you're calling, we will collect your demographic information, insurance information, then go ahead and schedule your test. So now when it comes to vaccines, kind of the conversation of now, really, everybody wants to get their hands on a vaccine. Everybody wants to know, what is the availability? What's the effectiveness? Can I get it now? What will I be eligible? I may already be over 65, but there's again a priority list for even those in priority group 1A right now. What are the side effects? When can I get my second dose? Can I choose which vaccine I'd like to get? So people are calling in to your contact centers consistently right now. And from what I've heard across a range of all of our health systems, it's getting a little bit too much. It's really deviating your agents away from still looking after your patients who have regular health concerns outside of anything to do with COVID vaccines, or let alone COVID at all in general. So how can we do that? How can we help? So when it comes to scheduling, we can automate making an appointment, canceling that appointment, rescheduling, and confirming, just like we do again with those COVID tests. We can register people and or take them through to scheduling a vaccine based on their eligibility and screening questions. So if they are a fairly healthy 32-year-old person with no real health conditions, we can still actually collect all of their information and add it into your pipeline or host it on a Varmo's database. So when state guidelines say you can now vaccinate people in this particular group, we can actually make automated outbound calls to them to schedule in their vaccine. So you don't manually have to go through that effort. So we can schedule that appointment and the second dose. And again, depending on your preferences, the second dose could either be scheduled when we schedule the first dose. We could make that call to them once they've had their first dose. You may wish to have the nurse or the technician administering that vaccine schedule the second dose for them live in person. It's entirely up to you. And of course, everything we do is fully and deeply integrated into your EHR, whether that's an Epic or a Cerner or anything else, as well as your contact center stack. And again, whether it's an Avaya, Genesys, Cisco, or something else, we've done them all. And the best part is it's a true omni-channel deployment as well. Some people may not be comfortable sharing, pertinent information like their insurance details or the social security number, or if it's outside of vaccine scheduling and, maybe a regular appointment and sharing their credit card information. Whilst they are still on the line, our virtual agents on the phone can actually text the user to their cell phone. So they can complete the information on their phone or on email, and it's being understood by our AI brain in real time. So once they've completed a form, let's say on their phone, they can just go back to, continuing that voice call, and the bot will already have seen, absorbed, understood the information that's been put in, validated, let's say, the social or address and credit card information, so they can continue on with that conversation in voice without any errors happening over the phone, through text. So in addition to that, US healthcare lost a substantial amount of money a few years ago, let's say pre-COVID, with people who just failed to turn up to their own appointments. And that's even more important to prevent now with vaccine scheduling. So we need to make sure everybody does turn up to their appointments. And if they can't make it, that's okay, kind of. But at least let's make sure we can give the vaccine to somebody else, because they will go bad and they're very valuable and people will do anything to get one right now. So we will proactively reach out to them with calls and text messages to have them confirm and reconfirm that they can actually turn up to that particular appointment. We can also look at the changes from the process from state guidelines to make sure that it's easy for your staff to validate and say who's next that we're going to call in the pipeline and in terms of a priority list to get them that vaccine as well. So my old CMO used to say, if you can't measure it, there's no point in doing it. So every single day, the relevant folk at your end will get an email, and you can check all this in terms of our analytics online as well. So you can see how many conversations were had. The previous day, maybe in this particular example, is just under 15,000. How many were successful? What's the level of disambiguation, which means somebody could have just said vaccines. Okay, well, what would you like to do about vaccines? Do you want to know more about them? What vaccines are available? The side effects? Would you like to schedule one, reschedule one? Your first dose? Is it a second dose? What about vaccines? So we'll offer the user, a number of options, and we'll figure out which path they would like to go down. And then ultimately, my most favorite statistic is this one, the level of agent intervention. So this shows on this day, there were 0 transfers to an agent. So it's 100% containment of the calls for this particular use case. So really alleviating that burden of your human agents in that contact center. So now we'll actually come into a live demo. I will call our line to schedule my vaccine as a person who would likely be in priority group 1A. Please do note, since this is for demo purposes, it does say so at the beginning of the call, just in case anybody gets their hands on this number and feels they're scheduling a real vaccine. That's the last thing we'd want them to feel, that it is happening. So this is just, again, for a demo, and have a listen to this. I'm actually going to make that call live right now.
You've reached a conversational artificial intelligence assistant developed by Avamo. The following interaction is for demo purposes only. Hello, and welcome to Avamo's COVID-19 assistant. My name is Sana, and I can help you schedule an appointment to get vaccinated. Whom do I have the pleasure of speaking with today?
Tony Stark.
Thanks, Tony. Have you already registered with us to get a vaccine?
No, I haven't.
Okay, I'll need some information from you to schedule your vaccination. Can you please tell me your zip code?
94115.
Thanks. I've noted that you're in San Francisco County. Are you currently, or will you turn 65 years old within the next 21 days?
Yes, I'm 67 actually.
All right, this means you're in the high priority category. Have you been diagnosed with COVID-19 and are currently under quarantine?
No, I haven't.
How about in the past 90 days? Have you been diagnosed with COVID-19 in that time?
Yes, unfortunately.
I'm sorry to hear that. As part of your treatment, did you receive a monoclonal antibody or convalescent plasma treatment?
No, I did not.
Okay, just a few more questions. Have you had close contact within the past 14 days with a symptomatic person under investigation or with a confirmed case of COVID-19?
I have not.
That's good. Are you experiencing any of the following symptoms? Fever, cough, shortness of breath, runny nose, sore throat, severe headaches, loss of taste or smell, chills in the absence of fever, vomiting, diarrhea, muscle pain, or a new fatigue?
No, none of those.
Great. We're almost done. You mentioned that you were in San Francisco County, so I've already got your location. What is your date of birth?
Actually, I'd like to get vaccinated in Santa Clara, if possible.
Okay, I've updated your preferred location to Santa Clara County. Ready to tell me your date of birth?
My birthday is December 20th, 1954.
Thank you. I see that you are calling from 585-953-9867. Would you like me to text you confirmation details?
Yes, please.
Great. Now let's schedule your appointment. Are you available tomorrow morning at 10 a.m.?
No, do you have anything next Wednesday? Preferably in the morning?
It looks like I have an opening on Wednesday, February 17th at 11 a.m. Shall I schedule you in for then?
Yes, that would be great.
Perfect. You are now confirmed for your COVID-19 vaccine. Please arrive 15 minutes before the appointment and bring some form of government ID. You'll also have to remain on site for at least an hour to allow for observation after your vaccination. I've texted you a confirmation to your phone number and will reach out again closer to the appointment date. If you cannot make your appointment on time for any reason, please call us back immediately to reschedule. Thank you, and stay safe.
Well, there you go. So apologies if you had any interference on the audio on that, but that was a live phone call I was making from my cell phone. So as you can see, it's a clinically accurate in terms of eligibility and the scheduling process. It's very much a human-like interaction. And as you saw when it asked me to confirm my date of birth, in fact, I didn't want to answer that question. I wanted to change the location where I wanted to get vaccinated. So it really allows for a dynamic multi-turn conversation, and that can happen at any point in the conversation. You may wish to go back and be like, oh, actually, I forgot my date of birth. It's 1955 as opposed to 1954. Again, deeply integrated into your EHR and contact center stack to have your agents focus on more of those non-COVID care areas and more complex matters. But that being said, if at any point the system hears a high level of frustration, we can transfer to a live agent as and when required, and we can set those parameters with you too. So, there's a lot of benefit in terms of using Avamo's conversational AI and on natural language processing to have, callers have a natural conversation to get exactly what they want without having to, navigate long and complicated audio menus. And the way we do this is by a range of proprietary technologies, such as our speech to intent. So it's our patented automated speech recognition and our NLU engine. So it really understands the meaning and the nuance and really the intent behind the question and not just the words. To getting that intent right itself reduces your average handle time by around 30 to 40%. Next is our call steering. So you don't have to press buttons to get to where you need to go to, like on a traditional IVR. You can just say what you want, and the platform will automatically understand the sequence of utterances and really determine, the user intent to steer them in the right direction for that best response in the flow. This really kind of removes a lot of the complex call center navigation and provides a high quality in terms of self-service experience for those end users. In terms of a proactive experience, so providing a personalized and proactive experience, we're able to identify the user based on things like their phone number. As you heard in that demo earlier, it recognized the number I was calling from. So that helps to start authenticating the user so we can anticipate the needs and proactively address their issues without even needing an agent on the phone. So for example, it can automatically be personalized to the user's preferred language. So it could start speaking to me in Spanish or in French as opposed to in English or vice versa. Next is shift left to digital. So again, as I mentioned earlier in the call, at key moments during a specific call you're having with one of our virtual agents, we can offer additional information or capabilities through digital channels, such as SMS or even on the mobile web. So this really helps to gracefully transition, customers and patients calling in to rich interaction channels and eliminates the hassle of things like call disconnects and let customers continue from where they left off if the phone cuts out, or to provide in secure information or complex information that they may not wish to provide over the phone. In terms of voice biometrics, to use a combination of noise cancellation and deep voice print analysis. So our voice biometrics can help kind of match incoming calls to customers' voice profiles. So it really helps to also defend against record and replay type security issues. So it's really quite advanced in how that works. In terms of handling call volume spikes, it's probably why you're listening to this webinar today, due to the massive spike in volume you're getting right now to your contact centers, especially due to COVID vaccines. So our conversational IVR helps to automate, a lot of these processes and eliminate, a lot of times those live agent handoffs for a significant proportion of these calls. So it means you don't need to double the number of your call center staff. You don't need work on retention or getting an outside source to help you. We can handle all of that burden and more. In terms of the NLU and human speech synthesis, so it's our automatic speech recognition, and it delivers advanced NLU at a word error rate, so we'll call it WER, of less than 5%. So coupled with that, the human-like nuanced speech synthesis really generates like a tone-sensitive and crisp voice output for you. Languages, so we're actually deployed in over 50 languages. So people could come in again, a variety of languages and have this conversation as well as in different dialects. So bot will always respond to your users in the language they ask a question or in the language they speak. So it could be 2 or 3 different languages, maybe even spoken on the same call by the same user, just to make whatever they're trying to do as easy as possible for them. And then finally, as I again mentioned earlier, Avamo can be deployed in cloud native as we are now, or containerized technology to really help deploy your cloud IVR in a matter of weeks as opposed to months. Again, this could also be in a private cloud behind your firewall or traditionally on-prem. So hopefully this has given you a pretty good idea in terms of Avamo's capabilities to help address the call spikes and automate scheduling of vaccines, COVID tests, and of course, this does transcend out to scheduling regular appointments with PCPs or other healthcare type appointments, as well as the rest of our healthcare use cases. So for more information, please feel free to reach out to me directly or check it out on our website at avamo.com. And thank you all again very much for your time today. Hope you stay safe and hope we all get our vaccines pretty soon. Thanks again. Bye-bye.
Hey, thank you, Kunal. Ladies and gentlemen, that was our speaker, Kunal Contractor. Kunal, before you go, I actually have some questions that I've collected from the audience for you. So if you don't mind staying back for a minute and take some of those.
That's not a problem.
So we have a member here who's asked, given how important and urgent the vaccine drive is, how fast can you get this thing going up and running and going and live?
It's a good question. So typically we could probably have something like this up and running anywhere between around 4 to 6 weeks. All the flows and the conversational trees are clinically validated flows in terms of registering them as a patient if they're not already registered in the system, to scheduling the appointment, the outbound capabilities for reminders, the digital handoff to continue a conversation in text or to complete information like the registration form. All that stuff has already been built. So all we're doing and spending that time is connecting it into their Epic or Cerner or EHR environment and integrating into their contact center stack. So if people called in and they wanted to press 2 for COVID tests and vaccines, for example, just plugging that part in. That's really all it is. And typically the biggest delays would, honestly come from going through probably the legal process and getting the contract signed and the integrations and making sure we get the APIs. But once we have all that, about 4 weeks, maybe 6 weeks max.
Okay, excellent. Thank you. One more question here. Would you sign a BAA with us if we were to do this?
Well, yes, absolutely. So all of our healthcare clients, we have a BAA in place with them. It's it's just part of the process we go through, and typically we just generally tend to sign the BAAs from the health system or payer, whoever we're working with, pretty much as it is, as long as there's no contradicting terms to the MSA in place, which generally there aren't. So yeah, not a problem. Good question.
All right. Okay. We're good. Folks, if you have any more questions, please feel free to email us and get in touch. We're happy to answer them offline. And thank you, Kunal. And just wanted to say, please join us for our future webinars. We've got an ongoing webinar series in 2021 after an exciting 2020. So once again, thank you for joining, everyone, and thank you, Kunal.
No worries. I'm not sure if exciting is necessarily the best word for 2020, but it certainly was an eventful year. All right. Thanks again, Manu. Appreciate it.
All right. Thank you.
Bye-bye.